For those of you who I haven't met, and I suspect many of you I have, my name's Leanne McLean, and I'm Tasmania's Commissioner for Children and Young People. And I'd like to welcome you to the launch of A Place at the Table, which has been an investigation into the change to the case management of children and young people in care in Tasmania. And I would like to begin by acknowledging that we are on the lands of the Palawa people of Lutruwita. I'd like to acknowledge Palawa elders past, present and emerging, and any Palawa people who have joined us here today. In particular, I'd like to acknowledge that for more than 40,000 years, 50,000 years, 60,000 years, the Palawa people have raised their children in connection with their country and their culture right here in Tasmania, Lutruwita. And there is so much that we can learn from the Palawa people about tolerance, respect, and resilience, and also for our children. Thank you very much for coming along today. There's a little bit of housekeeping to do at the beginning. First of all, I think I've mentioned to people as they came in, it's very handy if people can keep themselves on mute throughout for everybody's listening comfort. There will be an opportunity at the end of the presentation for us to be able to ask questions into the chat function. I also want to flag that for people who might be experiencing some Wi-Fi issues, sometimes turning your video off can really help. So I won't be offended if people turn it off, or maybe you want to get on with having lunch if you've had a busy day, and I won't be offended if you want to do that either. So it's perfectly fine for you to turn your video off. I also just want to remind people that today's webinar is being recorded and will be made available on the Commissioner for Children and Young People's website after today as a part of a suite of resources that are available for the release of the report. I also want to remind people that today we're going to be talking about the experiences of children, young people and others in care and with the Tasmanian care system. And for some of you, you might find some of today's talk a bit upsetting. So if you have any concerns, please reach out to some of the support services that we've listed there on the screen now. Or if your employer provides employee assistance, please reach out to that as well. And I think I've already noted that that we're recording today. And just for our team who are online, I'm just noticing more people are coming into the waiting room. Today's webinar really provides an overview, a high-level overview of my investigation, the findings, including the nature of the change to case management and the effects of this change on the rights and well-being of children and young people in care. And it's always good to start with a bit of background. And I think in this case, we should start with the words of a young person who is in care. Back in 2022, I received an email who told me that about 300 children and young people were going to be removed from their child safety officers and placed onto teams. This was concerning to me. I also received a lot of contact from stakeholders, particularly carers right around Tasmania who were very concerned about the change, also from staff within the child safety system and other stakeholders to the system. I heard that the change to case management meant that children and young people in care no longer had a dedicated child safety officer, and instead they were allocated to team-based case management, and they could contact the child safety service through a generic email or phone number. I was concerned that the development and implementation of this change might impact on the rights and well-being of children and young people in care. Now, as many of you will already know, the Commissioner for Children and Young People Act in Tasmania, which is the governing act under which I operate, was changed in 2016 to enable the Commissioner to undertake own motion investigations into matters that they thought were necessary. based on what I heard in 2022, I decided to initiate an own motion investigation under the Commissioner for Children and Young People Act. And I think it's worth noting that this is the first time a commissioner in Tasmania has utilised the own motion investigatory powers in this way. So we have learned a lot along the way, and we have undertaken this investigation in partnership with Children and Young People in Care, who have helped guide it. And we've undertaken the investigation with the support of the Department for Education, Children and Young People in the spirit of continuous improvement. And I think that is an incredibly strong foundation from which we have begun. So if we go to the terms of reference that we have for the investigation, and we just think for a moment about why each of you are here. You're here because you've made an important contribution in one way or another to this investigation, or your organisation has. And it was very important to me in releasing this report that we release it directly to the stakeholders who have an actual stake in the investigation from the outset. So the media won't have availability of the full report until after we have had this discussion today. It was very important to me to release it to you first. I've also held discussions over the course of the last few days with Children and Young People in Care who were directly involved in the development of the investigation, and they will continue to be held even directly after our discussion today. So if we just move to the terms of reference and what we did, basically, I was looking to develop a detailed understanding of the new out-of-home care case management model in the context of relevant policy, practice and legislation. I was then looking to examine the effect of the new model on the rights and wellbeing of children and young people in care. And finally, I'm reporting and making recommendations in respect of the introduction of the new model in line with my general functions as Commissioner. And to realise these, I really needed to hear from a broad section of stakeholders within the out-of-home care community, and most importantly, from children and young people in care. So let's have a bit of a talk about what we did to be able to hear the views of stakeholders and children and young people in care. We had almost 70 children and young people with a care experience participate in the investigation. So we developed an online survey, which we called the Commissioner's Big Questions, and that was developed or co-designed with young people with a care experience. 20 individual young people responded to that survey. I also had individual discussions with 7 young people who spoke to me about their experiences of the new case management model. And more than 40 children and young people participated in an art activity, which is called A Place at the Table. That's where we got together and we made art on plates, on bowls and on biscuits. And I've got an example of one. Oh, I'm not sure if you can see it right here. Oh, there we go. It folds in and out. And I've been carrying this one with me for a few weeks now as we talk to people about the report. It says, "Children should be heard." And in the middle, it has a picture of a child and their families. The investigation, and you'll see images of these crockery and biscuits throughout the report when you download it from the website, and also throughout today's presentation. The investigation also received 67 submissions from individuals or groups of individuals and organisations that support or work with children and young people in care. Respondents included the Department for Education, Children and Young People, child safety officers, carers, care providers and other stakeholders. And many of you are here today, and I want to thank you for the wonderful contribution that you've made. Qualitative data collected during the investigation through these submissions, noting that we also had facilitated submissions, which is where we met with groups of people, recorded the submission process, and then used transcripts into the investigation. So all of that qualitative data that was collected from children and young people and others was thematically analysed using a rights-based framework based on the Charter of Rights for Children and Young People in Care in Tasmania. And here's a copy of the Charter and a QR code there for anybody who would like to go straight to the website where the Charter is. It's been around for a few years now, but the Charter outlines the 9 rights that children and young people in care in Tasmania have. It really constitutes a promise that the Tasmanian government have made to children and young people in care around what they know they need to have a good life and a good experience in the care system. We also had quantitative data provided by the Department for Education, Children and Young People on things like the numbers of children who had been allocated to teams and the characteristics of children who had been allocated to teams. I'll talk a bit more about that later, but I do want to note that there are some limitations on both the qualitative and quantitative data in the investigation generally, including, for example, that, and this was flagged by the department, that those who may have experienced a positive change from case management may have been less likely to respond to our investigation findings, to our investigation offers for participation. So I do think it's important to flag that as a limitation, and it's also flagged in the report. So if we move on now, I'd just like to, before we move into our findings, I'd like to take a moment to talk about the context that we find ourselves in at the moment as this report is landing. Staffing shortages are something that I found really underpinned the change in the first instance. Those staffing shortages are ongoing. And I've learned through this report the extraordinary value that is placed by child safety officers in particular, but others working through the child safety system, on the relationships that child safety officers and others develop with children. It has really been imparted on me how important that is and how difficult that is at the moment in the environment that child safety officers are operating in, given lower than preferred staffing levels. And I really just want to shout out to people working in the system. You are doing an extraordinary job under difficult circumstances. And my intent in releasing this investigation at this time is to bolster efforts to enable your work to shine, particularly the relationships that you develop with children and young people to keep them safe. So moving on to what we found out during the investigation, the reasons for implementing the change to case management. So, informed by those terms of reference that I'm developing a deep understanding of what happened, I found that staffing shortages within the Department of Communities and then the Department for Education, Children and Young People, because of course we've had those big machinery of government changes throughout this time, caused the department to take a series of actions. And those actions included creating an interagency executive control group. And the purpose of that group was to ensure the safety of all children and young people in the child safety service through the implementation of what's called a coordinated response plan. And that coordinated response plan had 2 priority actions. The first one was to employ more staff. That was the first and very important action. And the second was to revise the supports that were available to children and young people in care, including implementing team-based case management for children and young people in the South, and a different approach to case managing children and young people in the North and the Northwest. And I found that neither of these approaches were based in any particular evidence. They were a result of staffing pressures that were being faced at the time. I found that parameters were set for the allocation of children in care to the revised supports for case management, to the team-based approach. But I also found that those parameters were then deviated from. So, for example, the parameters were that children who were safe in their care placement, stable in their care placement, and on long-term orders and requiring small or minimal support were to be allocated to the teams. However, I found in the investigation that children were allocated to the teams who required a high level of ongoing support for quite complex needs. And that included, for example, children in detention. I found that in the first 4 months of operation, about 395 children and young people in the South were allocated to team-based case management. And I want to flag a limitation at this point that no data was provided to me to help me understand the numbers of children and young people in the North and the Northwest that were impacted by the changes to case management there, which were different to the changes in the South. I found that the introduction of the coordinated response plan, which included that change to case management, represented a substantial systemic change within the system because it influenced the case management of children and young people in care. However, its design, its introduction, and its ongoing implementation has not included the level or quality of consultation, communication, monitoring, or evaluation that should underpin a systemic change and which would afford children and young people their participatory rights. So, for example, the governance structures associated with the change did not account or provide for the participation of children and young people, as is their right under the Charter. I found that communication with stakeholders, including and particularly with children and young people about the change, was inadequate. And this includes that children and young people in care were not afforded their right to receive clear information about the change to case management. The stated aim of the coordinated response plan, which included the introduction of the change to case management, was to ensure that all children who were clients of the Child Safety Service were safe. However, the coordinated response plan didn't include a methodology to measure the effectiveness of the implementation. And I do want to flag at this point that the Department for Education, Children and Young People don't agree with that finding, and that there may have been measures of effectiveness that were available internally. However, no information was provided to me to indicate whether the introduction of the revised supports kept children and young people in care safe. It also remains unclear throughout the time that I was investigating the change whether or not the change was a permanent change or an interim change. I found that the change to case management did initially reduce the numbers of children and young people who were awaiting allocation in the child safety system. And that's important because it shows that it enabled throughput in the system. I also found, however, that that was short-lived, and during the time which I analysed, those numbers awaiting allocation did again increase. I have since been advised that they have again moved to decrease, which is an encouraging sign. I found that the change to case management was not consistent with the participation principle outlined in the Children, Young Persons and Their Families Act. All children and young people in care were not provided with, and they would have been had this participation principle been upheld, but I found they were not provided with clear information about the proposed change in a way that they could understand it. They weren't provided with an opportunity to respond to the proposed change. They weren't provided an opportunity to express their views freely about the proposed change, and they weren't provided with assistance to express their views. And they are the four fundamental things that would need to occur for a child to realise their participatory rights within the system. I found that the change to case management had effects on the rights of children and young people in care through applying the Charter of Rights. And the following effects were identified for many children through consultation with children and young people, through Child Safety Service staff, and through other stakeholders. So you can see on the screen now, I found that right 1, the right to feel safe, was impacted. Right 2, the right to receive healthcare when it was needed, was impacted. And that was really because of communication breakdowns between the team's approach and the paediatric out-of-home care clinic. I found that right 3 was impacted, where children were not consulted and listened to seriously. And we've discussed that at length already. Those 4 things that you would expect to see for that participatory right to be met, we didn't see them in this case. I found that right 4 was also affected, in that children did not have regular meetings alone with their workers as a result of the change. And right 5, which is that children are treated respectfully, was also affected because children outlined to me through the consultation that they didn't feel respected in the way that the change was implemented. I also found that because of difficulties in communication with the teams, children weren't necessarily having safe contact with their families, in that some carers were effectively bypassing the mechanisms to arrange family visits and organising them themselves, because it was the communication between the teams was quite difficult. I also found that right 8 was impacted because children and young people could be less supported in their education and their life skills development, because that communication flow that was required to enable that education to occur broke down. I also found, and this again goes to my original shout out to child safety officers, that child safety officers, including those that were assigned to Teams 7 and Team 10, experienced significant challenges in case managing children and young people who were allocated to the teams, and that these challenges arose from overwhelming numbers of children and young people who were allocated to teams, that they weren't able to develop a detailed knowledge of individual children and young people and their placements, and that there was a loss of relationships between child safety officers and individual children and young people in care and their carers. And I heard very clearly from carers that they felt that too. I also found that child safety officers view their individual relationships with children and young people in care as critical to ensuring relational stability and to upholding the rights of children and young people in care. The change to team-based case management impacted the ability of child safety officers to establish and maintain relationships, which in turn influenced role clarity and job satisfaction. This contributed to the resignation or unplanned leave of child safety officers, which further exacerbated staffing shortages. I also found that the change to case management demonstrated a systemic lack of awareness of the principles outlined in the Children and Young Persons and Their Families Act, in particular, the participation principle, which is outlined in Part 1A, and the relevance of those principles to any decisions that are made under an act. Legislative principles appear in legislation, and they act as a lens or a guide through which the rest of the legislation should be utilised. So the participatory principle, or all of them really, but it's especially this participatory principle, is fundamental to exercising every part of the Children and Young Persons and Their Families Act, and we go into that in quite a bit of detail in the report. Interestingly, in looking at how that participation principle is outlined in the Children, Young Persons and Their Families Act, we discovered that it is not in alignment with Article 12 of the United Nations Convention on the Rights of the Child, and that needs to change. So they are the things that we found out. There are 9 things. And I'd like to move now to what we've recommended needs to change within the system. And to do that, I've made 7 recommendations. So this is where we come to that third part of the terms of reference, where I make report and make recommendations. So firstly, I found that the Department for Education, Children and Young People needs to take some immediate steps to reset its relationship with children and young people in care by demonstrating a commitment to recognising, understanding and upholding the rights of children and young people in care. And I recommended what this should include. It should include an acknowledgement that in developing and implementing the change to case management, that the rights of children and young people in care that are described under the Charter were not upheld. It should also include identification and, where possible, the development of plans to rectify any negative effect of the change on children and young people, including ensuring that children and young people and other stakeholders are provided with clear information about the change to case management, its duration, and what happens from here. I've recommended that the department make a commitment to work with children and young people in care and other stakeholders to refresh the Charter of Rights. This is an excellent way for the department to demonstrate their commitment to upholding the rights of children and young people in care. And further to that, building on that refreshed Charter of Rights, I've recommended the department work with the Commissioner for Children and Young People in the establishment of a rights-based monitoring program, so that my out-of-home care monitoring program can be based around the access that children have to their rights in out-of-home care. My second recommendation is that the Department for Education and Children and Young People develops and implements an internal strategy to increase staff knowledge and understanding about the rights of children and young people in care and their application in decision-making processes consistent with the principles under the Children, Young Persons and Their Families Act. Now, this should include, in my view, at a minimum, a new governance framework for systemic decision-making that includes the participation of children and young people in care. It includes a requirement that a proposed systemic change to the out-of-home care system should be accompanied by evaluation and review plans so that the immediate effects, the medium effects and the long-term effects of changes can be known and measured. And it should include a requirement that any systemic decision made to support the administration of the Children, Young Persons and Their Families Act is accompanied by what we call a child rights impact assessment. So that everybody understands that in proposing to make a change, we understand that the impact on the rights of children and young people in care will be as follows. I don't think people should be making systemic changes under the Act without understanding what the rights implications are for children in care. My third recommendation is that the Department for Education, Children and Young People urgently develops and implements an evidence-based approach to case management that upholds the rights of children and young people in care. The new model should be developed with the participation of children and young people with a care experience, and it should be evidence-based. Consistent with the evidence, this new model of case management should prioritise relationships. Child safety officers should be supported and encouraged to establish safe relationships with children and young people in care, taking into account the needs and wishes of the child or young person. And that independent review of that model should occur at regular intervals. I'm recommending that while that new case management model is under development, because that will take some time, particularly if we enable children to participate, that the government should provide adequate resourcing to the Department for Education, Children and Young People to support the continuous recruitment of appropriately trained staff. And that will ensure that child safety service teams can continue to implement a key worker model in the interim so that children and young people in care are allocated a dedicated child safety officer who they know. I'm recommending that the Department for Education, Children and Young People develops and implements a comprehensive communication strategy for all stakeholders, including and especially children and young people in care, and that this should include establishing a child-friendly communication strategy that is informed by Lundy's model of child participation, which is, in my view, a best practice model to enable children to be heard. Minimum communication requirements with children and young people in care should be established to give effect to the participation principle under the Children, Young Persons and Their Families Act. And a dialogue between all stakeholders with a special emphasis on engaging children and young people in care and in decision making should be promoted so that everybody knows what is going on. That I've also recommended the creation of an accurate, centralised information portal for all information about the Department for Education, Children and Young People's commitments, processes and services for children and young people in care. And this must include a child-friendly space where children and young people can find out about the care system and find out about their rights. I'm also recommending that the government amends the Children, Young Persons and Their Families Act to ensure consistency with Article 12 of the United Nations Convention on the Rights of the Child, and that the government ensures that the Department for Education, Children and Young People is adequately resourced to enable the practical realisation of the participation principles contained in the Children, Young Persons and Their Families Act. So they are the 7 recommendations that I've made. We'll very shortly move to some questions. We're going to open up the chat line so that people can type any questions or comments that they have in the line, and that the administrators of this webinar will be able to see them, and will hopefully answer of many of those as we can before the webinar completes. But while people are getting ready to put their questions in now, so the chat should be open now. I'll just make sure that it is, and that everybody can chat to hosts and co-hosts. I really just want to flag that this week we will also see the government provide its response to how it will implement the 191 recommendations of the Commission of Inquiry that has been operating in Tasmania for some time now. What's been fundamentally clear to me during this time is that we have to remember that a child or young person's right to participate, to be heard, across all aspects of our system, and out-of-home care is one aspect of the systems that will be changing in response to these recommendations of the Commission of Inquiry. Their right to be heard and to participate is fundamental to their safety, and it's therefore fundamental to the success of any reform agenda. The right to participate and be heard is what we call a gateway right. It enables access to all other rights, including the right to be safe and free from violence and abuse. So we must get this right first if we are going to experience success in implementing the 191 recommendations of the Commission of Inquiry. And I think that this investigation shows that there are significant systemic challenges in enabling that participatory right. We need to make sure that our systems are arranged and resourced appropriately so that children can put their hand up and have a say and be heard.